Okay, welcome everyone again to Health Agents Network AEP Prep, 7 Steps to Success with collaboration from Bankers Fidelity Online Training. Let's go ahead and get started. Again, if you have questions, comments, concerns, threats, or promises, feel free to throw them in the question area of the user panel, and we'll address them as we go along. But I want to talk about AEP, which is the annual election period, as we all know, in the Medicare market. Well, according to Kaiser Family Foundation, there are about 54 million Medicare beneficiaries, and 39 million have a Part D plan through either standalone or an MAPD plan, and that includes corporate plans or employer-sponsored MA plans as well. However, what this means is that there are 39 million people out there that have to make a decision in a 54-day time span. Do they have the right plan? They need to look at new plans, what's going on with the market, what's going on with their finances, has their health changed? There's a lot of things going into AEP, not only for agents, but for the consumers as well. And for the agents, we start now because we have to certify and get started and order supplies and everything else and really build up until October 1st, where most consumers have a much more limited window because nothing is released to the public until October 1st. So they even have a shorter window to go through and check out plans. And of course, by that time, the mailboxes are being overrun. They're getting ads on the radio, ads on television, and all kinds of marketing thrown at them. So it really can be a stressful situation for your average Medicare consumer. So you really need to map out your AEP. Again, 54 days, there's no time for guesswork. If you have a bad mail drop, a mail drop could take about 2-3 weeks to really start getting going and start getting those cards back. Well, guess what? Basically, half your AEP is gone. Now you've got the last half to go out there and try and make something of your AEP. So if you start planning now, when October 1st hits, you're launching a marketing campaign, so you're not still trying to figure them out. You are hitting the ground running. This is a side note per compliance. When it comes to Medicare Advantage and Part D plans and AEP, you cannot market next year's benefits until October 1st. You can't advertise AEP until October 1st. So you can't take out ads in September or next month and start talking about your next year's plan options. Medicare could shut that down, and so can some carriers. So don't market AEP until October 1st. However, that doesn't mean you can't do a lot of back-end work, which we'll talk about today, to make sure your AEP is to its full potential. So step one, let's just get right into it and talk about what you could do to map out your AEP. You need to break down your current clients by carrier and by plan type. This way, when the new plans are released, you can quickly filter your clients because you really have 2 sets of clients sitting with you right now. You have ones you want to stay on the current plan. So when October 1st hits, do they need to make a move? And you have to have your pile that says yes and your pile that says no. So it's a matter of retention or replacement. That's the name of the game with your current clients. But you want to make sure, and this is part of the hard part, is that you are going out there and touching each and every one of your clients, because you may think, okay, they're fine, they'll be stable, they'll stay where they are, but don't forget, there are millions of dollars in marketing being thrown at them through mail, through media, radio, television, through friends, through seminars, through other agents. They're trying to get them to change plans. So you need to make sure that you are talking to your current clients about what to do. This is also why it's important now to reach out to your current clients to remind them who their agent is. So when you send them a letter, which we'll talk about here in the next steps, when you send them that letter saying, hey, please meet with me because we need to talk about other plans, or please stay where you are, they remember who you are, telling them that advice. So now is no better time than ever to reach out to your current book of business and say, hey, don't forget about me. I'm still your agent. I'm still around. I can still help you. Before you make any decisions, please contact me. So step 2, organize your prospects. Not only do you have to organize your current book of business, your current clients, you also have to organize the people who have not bought from you. And really here's your organizing by type of coverage. Because there is such a limited time span, we always want to look at adding new people, but you have to almost prioritize on your prospects. Your group prospects, people that have employer or group-based coverage, they may stick where they are. They're more probable to stick where they are than someone with an individual plan. So prioritize your list. Don't just go alphabetical or anything like that. Prioritize by type of coverage. So when you're meeting with clients in the field or prospects in the field, you want to make sure you know what type of coverage they have. And it's good for you to know some history on that plan too. If they have union coverage through, a major manufacturer, there's a good chance they're not going to move. So I would move those prospects to the very bottom of your list on trying to get the change. So if you get to them, great. But there's a high probability they're not going to move off their union coverage because most of those people are very loyal to their union. However, if you meet with someone that has a Medicare Advantage plan, put them higher on your list because there's a good chance that maybe that plan has, really steep changes, or maybe they are going to even leave the service area altogether, which creates an not open enrollment, but an SEP into a Medicare supplement. So you really have to prioritize your prospects, if you would. Again, not just by name, but by what type of coverage they had. So you know that if ABC plan is leaving your area, you can run your prospects and you know that these are the people that have to make a decision. They have to make a move, and you want to be the one that's in the house or on the phone with them facilitating that move. So organize your prospects. Now, the question came up, how do I organize our prospects? Either within your CRM, if you're using a CRM, or if you're not, that's fine. Put them in a spreadsheet. Some way, somehow, you have some record that you met with somebody, whether it be a notepad, whether it be index cards, whatever system you're using. If it's not a web-based or not, a CRM-based program, use a spreadsheet. A simple spreadsheet will do wonders versus, miscellaneous pieces of paper all over your car, under your seats, in your trunk, in your briefcase, everywhere else you jam paper. So organize. Key to this business, one of the keys is staying organized, because the moment you go unorganized, that's when everything kind of cascades to chaos. So step 3, next thing you do is certify. I realize with Medicare supplements, it's not a necessary step, but if you're going to choose to offer a Part C or Part D plan, you need to certify as soon as possible. Now, AHIP is open, but I would recommend holding off until the carriers come out with their reimbursements. Last year we saw a lot of carriers give $50 towards AHIP if you go through their portal. So hold off on that. I realize I just said ASAP, but hold off on that. But as soon as the carrier certification is open, jump on them, because you don't want to be, September 20th and then trying to scramble to certify, because once you certify, for some carriers, it's not instantaneous. They have to update their back-end systems, get you in the system. Then you have to order supplies. Well, it could be a couple-week process. So there you are, September 20th, trying to jam out a certification. Then you finally get updated. Then you finally get supplies, and now it could be 3-4 weeks later where AEP is in full swing, and you're still waiting for applications or kits to come in, and you can't do anything. So certify as soon as possible. Get those certifications up and going. And the other side of it is, what if you don't pass the first time? Then take it all over again. So definitely certify ASAP if you are going to offer Medicare Advantage or Part D plans this open enrollment. So again, you are 100% ready to go. Now, step 4, part of step 3, ordering supplies. We have seen some carriers with some huge delays when it comes to supplies. So as soon as you're certified, get supplies. I will tell you this, if you have a local rep in your area for whatever carrier you're offering, become friends with them. Reach out to them now and let yourself be known. The better they know you, the more likely they're willing to work with you. Hey, I've been writing a plan for a couple of years now. I appreciate it. Can we meet for coffee? Want to go over some strategies for AEP? You know what? They have numbers they have to hit too. So befriend your local rep, and they will do more for you. So if you do maybe run out of supplies, maybe they have a secret squirrel stash at the office that you could tap into. Maybe you run into a problem they can help you out with. So when it comes to ordering supplies, don't be afraid to friend people at the company now. So if you do run into a snag later, they'll be more likely to help you. And if you're showing effort to sell their plan, that means you're working for your sales, not only your sales, but their quota as well. So they could actually, use you as, hey, look at this agent I'm helping, and they're selling our product and more. So get your name in early so you're not waiting to write business. You don't want to be sitting there October 20th with 5 people on the sidelines going, I'd love to buy from you, but you don't have applications. You don't have supplies. I can't do anything from you. So step 5, organize your marketing. Here's where all your lists, all your organizations come into play. Remember, you cannot market AEP until after 10/1, but you can line it all up waiting for the floodgates to open once 10/1 hits. So we do have a letter that is compliant that you can send out now. And you'll watch your email, you'll get a copy of this, and it's a generic annual review. It doesn't specify AEP, it doesn't specify a particular product, it just says, hey, it's time for your annual review. Now, I realize if you meet them now, you'll have to meet them again in October, but that's okay, because they're going to remember you. And you'll have an inside track to what they have and what their concerns are halfway through the year. Because if they're sitting here saying, you know what, I love my plan, I love my doctor, I don't care if it goes up in premium, I'm going to stick with it, great, good for you. That person may just need a form letter in the mail and nothing else. So if that person's upset because their doctor left or they're not happy with the way the plan is, you know that's a hot prospect. So if you haven't reached out to your current clients in a little while, send them that generic annual review. Get in front of them, because remember, your prospects and your clients are another agent's prospect. So I have never walked in someone's house and said, oh, you currently have an agent? Oh, you know what? Well, you go ahead and call them. I'll go ahead and see myself out. You wouldn't do that to one of my clients, and I wouldn't do it to 20 years. If I'm in that house, I'm there for a reason, to help that person out. So don't think just because they're your client, they're not going to talk to any other agent, especially if you haven't talked to them in a year, 2 years, 3 years. If you haven't, drop them a note now, because otherwise another agent will during AEP, and you'll lose them as a client. So again, organize your marketing, line up all your people and your form letters. So this is where we get to step 6, organize your letters. We have 2 letters we're going to send out. One that's generic that says, you know what, you should probably stay on your current plan. It's a very generic letter, it's compliant, and you could send it out, and that way people get that and say, oh, that's great. One tip, I would get a stamp from your local office supply store and mark it as urgent, or get a custom one that says your current plan information or something, stamp it with the red ink that shows importance, because that is more likely to get opened. If you have the ability to, I'd recommend handwriting the envelope. If you send them out a label, which is far more efficient, I get it. A lot of people don't have time to do that. However, handwritten envelopes are more likely to get opened, because when I get a handwritten envelope in the mail, I think, wow, someone took the time to write this down. This is more personal. What is it? So I'm going to open up that letter. Same thing you should do. Especially, again, if you haven't talked to your clients in a while and you have your, let's say, your return address label in the top left corner of that envelope, they may not remember who you are. So get that stamp, handwrite it, preferably in blue ink because it stands out from all the black ink traditionally used by printers, and you're more likely to get your letter opened. Because don't forget, the mailbox is going to be full. The second letter we're going to give you is a generic letter again, but it says, hey, you know what? It's time to reevaluate what you have, and I'd be happy to do that with you. So you're going to have 2 sets of people in your book of business, stay or change, or retain or replace. However you want to label them, you're going to have that. So I would highly suggest you have your book of business broken down so you can start firing off those people right away. You can start handwriting the envelopes now. There's no reason you can't handwrite the envelopes and just stack them up, and then all of a sudden when 10/1 or right before 10/1 hits, you know what the plans are. You can pre-stuff your envelopes, so when 10/1 hits, you drop them all in the mail and you're ready to go. 6.1, the 3 goals of AEP. So this is kind of a sidestep to step 6, is again, you want to maintain your current clients on their plan if they don't have to change. You want to change clients to a new plan if needed, but you also want to acquire new clients. Now, marketing in AEP is very difficult because you're going up against major carriers. However, this is when referrals really step in. This is when, if you are there helping out your clients, they probably have friends and family and neighbors who are in the same boat. So make sure that when you are reaching out to your clients and prospects, you tell them you're available. Now, one question came up, said, I have a large book of business. How do I do this for everybody? That's a good question. Maybe you hold a personal seminar for your clients. If you are representing a plan, get the information from the plan, get the approved presentation, and do a seminar at a local library or your office or somewhere else, somewhere that can facilitate 20, 30 people, and maybe do a handful of those during AEP. Hey, you know what? I've got these seminars for my clients and their friends, and always say, not just clients, my clients and their friends or family, to come in and hear about the new plan, or come in and hear about what's going on this annual election period. So it invites friends and family there. It makes it a non-threatening place. You're not going to their home. They're not going to the office. It's a neutral ground, and just do some of those. I've dealt with agents this past AEP who had a book of business 500-600 people. They had to do some seminars. So don't be afraid to do these little personal seminars. Yes, if you're talking about Medicare Advantage plan or Part D plan, you have to register it, but you have to have the presentation and the plan information to do it as well. So don't be afraid to do those, and just market it out to your current book of business. And then, again, make sure you're also offering your services to these new clients. So step 7 of all this, how are you going to wrap this all up? You gotta call them. Don't just think dropping a letter is going to do it. You need to drop the letters and then call if you can. First priority are the people that have to change, especially if you have a plan leaving the service area, because that's open market and everyone knows it. Everyone knows that plan's going to be leaving, and everyone's going to be going after that book of business, including the carrier that's leaving. They may be trying to roll them to a different product. So you want to get there before they get the call directly from the carrier or another agent. Now, your current book of business, hopefully that letter will suffice, but I would still recommend calling them and saying, hey, you know what, you get my letter in the mail? You have any questions about your plan? And they say, nope, I think I'm fine, great. If you have any questions, call me. If you think you find a better plan or something you want to change to, call me. I'll be happy to review the data with you or the information with you. Because remember, your clients are not the agent's prospects. If they don't hear from you at all and don't think there's nothing to do or don't know what to do, they're going to get these fancy solicitations from these carriers spending millions of dollars on these fancy kits, and they may be swooned to call and say, hey, tell me more about your plan. And guess what? They're going to enroll them on the phone, they're going to send them out an agent, and you're going to lose your clients. So call. Either keep them or set the appointment, invite them to a seminar, invite them to your office, invite them to meet somewhere, set up shop at a local coffee shop, maybe every Wednesday at 8 o'clock in the morning from 8 to 10. I'm at this local coffee shop. Come in and talk to me. Bring what you got in the mail, and I'll take a look at it. Whatever you could do to make yourself more available to your clients, definitely do. Again, we're going to have form letters. We're going to have more resources sent to you via email. So watch for those. If you have questions, you can always email me at mike.cotorna@healthagentsnetwork.com or call Bankers Fidelity. So again, available for free on Health Agents Network. It's coming. It's not finalized yet. So I was hoping to have it done, a little behind schedule, but that is coming. Once this video is posted, we'll have links to it, but you will receive an email with a copy of the overview and planning guide. It will have links to download the letters that I talked about, the stay where you are, the hates need to change, both of those to be used after 10/1, and also a generic annual review that you could use throughout the year. So more resources can be found on both Bankers Online Tools and Health Agents Network. Any questions, comments, concerns, threats, promises, please feel free to throw into the question area and we'll address them. But again, watch your inbox for those things. Go to Health Agents Network, become a member of our newsletter. It comes out once a week and just gives updates throughout the week, resources, and so on and so forth. Quick resource for those of you still there. Oh, someone asked for my email address. Absolutely. And put that in the chat. But one thing for those of you still on, I appreciate it. There is a new generic scope out there. We've been using the same generic scope of appointments since 2013. Aetna, I don't mean to bring up another carrier, but they came out with a new generic scope. Coventry for years has been doing the generic scope for years and years and years. So they came out with a new one for 2016. It is listed on Health Agents Network. If you go to the library section, I'm sorry, I can't type and do it at the same time. 1 second here. There we go. There's my email address in the chat area. Right now, if you go to Health Agents Network, click on Library. There's a little drop down. Just go Library section, and there's a 2016 resource guide on the right side. Click on there, and the new scope of a generic scope is listed in there, along with a bunch of other resources. So definitely download that and start using that now as your new generic scope. And again, feel free to check out the rest of the site and join the email list, of course. But at least download the new scope so you have that for your files. Someone asked, do we know any Part 2 plans leaving the service area right now? That I don't know. It's still pretty new. A lot of carriers are still hush-hush. A lot of the rollouts don't happen until July or early August, so we don't know anything yet. Again, carriers don't want to release that information. Typically, the biggest changes a carrier is having, or the bigger the changes, the longer they wait to announce. So they will go ahead, and if you see a carrier really sitting on their information, it's either really good or really bad. Your run-of-the-mill, not so exciting stuff typically come out right away because it's probably look the same as it did last year. So watch for the carriers are really holding on to information to the very end. Those are typically the ones that are going yay or oh no, we're in trouble. So HealthSpring sanctioning, no information yet on Cigna and what's going on with them. I haven't seen anything yet, but doesn't mean there's nothing going on. So, as of right now, they're locked. So we can't do anything with them right now. Hopefully they'll be unlocked soon from CMS, but right now they are just, we haven't heard anything yet to any release date from CMS. So oops on their part, but, I don't know if that was an adoption they picked up and it just went south, but they are working with CMS right now. So we'll hopefully see something here pretty soon. But thank you very much, everyone, for being on today. Don't forget to visit Bankers Online, Bankers Fidelity, great resources. Check out some of the extra resources they get or some of the extra perks they get as being a Bankers Fidelity client and you as an agent. Also, check out Health Agents Network for more resources and information. Again, this is Mike Catorna. Thank you very much for being on. Go out there, have fun, make money, and give impeccable service. Take care, everyone.